If everybody could take their seats, we're going to get started now.
Had to cool down.
Got a few more people filtering in. Cool. All right. Well, thank you all for joining us for this wonderful panel. I'm really excited to be getting some very diverse viewpoints today. So you can find their bio on the website, and rather than just kind of read off their bios, I think I'm going to let the panelists have an opportunity to kind of tell you their background and give you a little bit blurb about themselves. And maybe we can start with you, Shannon.
Sure, yeah. So my name is Shannon O'Hearn. I'm from Toronto. Okay. Can you hear? Everyone can hear me okay? Okay, perfect. So I'm here from Toronto. I work for one of the licensed producers in Canada called MedReleaf. So we got our federal license to produce and sell medical cannabis 2013, and I've been there since then. And my role there is managing their clinical research programs. So I help conduct studies internally, work with our patients and our patient care teams, work with some of our prescribing physicians, and then also help sort of manage relationships where we sponsor trials that are ongoing at universities and hospitals in Canada.
Hi, I'm Dr. Rachel Knox. I'm from Portland, Oregon, along with my family, who are also physicians in the space. We founded the American Cannabinoid Clinics, where we practice what we call clinical cannabinology. I'm also the medical chair for the Minority Cannabis Business Association, and as of November 2017, became the vice chair of the Oregon Cannabis Commission that oversees the Oregon Medical Marijuana Program. In addition to clinical care management in cannabis medicine, my group is developing our own training program for healthcare practitioners is going to be coming out soon, because we get a lot of requests from healthcare practitioners of all sorts, pharmacists to medical doctors, asking for some help and guidance in how to practice clinical cannabis and cannabinoid medicine. And so that will be a new resource and pipeline coming from us in just a bit.
Okay. My name is Dr. Chanda Macias. I am a cell biologist, studied cancer for over 15 years, and specifically cancer metastasis to bone. After working on several NIH grants, I kind of flipped over to training minorities in biomedical research by taking teams of medical doctors and PhDs and my advanced undergraduates to Africa. We focus on different infectious diseases there. And then I also focused on launching two billion-dollar brands with the company Colgate-Palmolive. And one was Simply White, which is off the market right now, but it was a great product when it was out. And it happened. Everyone with white teeth, that's me. And then the other one was Colgate Total, which is currently still on the market in Colgate's leading brand. So I have about 10 world patents, 3 US, have many scientific publications, and I entered this field with a strong research background, and I have a medical marijuana dispensary in Washington, D.C. We focus on the ailments and different strain alignment by looking at cannabinoid profiles of the strains along with terpene compositions. And my community outreach includes the chairwoman of Women Grow, also the Minority Cannabis Business Association, the board of directors. I currently is on the Cannabis Council for Southern University in Louisiana, and a whole bunch of other things, because giving back to the community is very important. Thank you.
Hi, my name is Kebra Smith-Bolden. I'm a registered nurse. I live here in New Haven, Connecticut, so you all are in my hometown. I work in the cannabis industry as an advocate, as an entrepreneur, as a patient advocate specifically. I own a company, CannaHealth, where we do medical marijuana evaluations and certifications. And the #1 diagnosis that we see is post-traumatic stress disorder. And a lot of the people who come in are not veterans. They're inner city residents with complex urban traumas. In addition to what I do with CannaHealth, I'm also a a co-owner of Cannabis Consultants of Connecticut, where we consult people who want to get into the business. We teach classes on everything from the science of the plant to actually the business of cannabis. In addition, I'm a member of the Minority Cannabis Business Association, Connecticut Coalition to Regulate Marijuana, and I'm also the president of the Connecticut chapter of Minorities for Medical Marijuana as well. Women Grow Connecticut. How can I forget that? I'm a market leader for Women Grow Connecticut.
Wonderful. So maybe the first question to start us off is, you all come from different areas, so Canada, Oregon, DC, Connecticut, with its own patchwork of laws around how cannabis is regulated. So maybe we can talk a little bit about some of the regulations that you're seeing, because it really does differ between every single state as well as every single country. So just kind of give us some examples of how it's currently regulated in your backyard.
Okay. Sure, I can start. So in Canada, medical cannabis is federally regulated. So the regulations have existed there since early 2000s, but the current sort of structure where there's a commercial industry that produces and sells the cannabis directly to patients under authorization from a physician, that was put into place in around 2014. So licenses are given out to companies to produce and or sell cannabis directly to patients. So as it works right now, a patient gets a prescription from a physician, they send it into a licensed producer of their choice across the country. I think there's about 40 or so in operation right now, and then the licensed producer ships the medication directly to the patient. So you've probably heard that legalization is coming down the pipeline as well in Canada, and towards the end of the summer, it will be also legal for adult use, and that will be sort of regulated under a separate sort of branch where people will, depending on the province, there'll be different ways that people can access medication from retail outlets and things like that, but the medical program is going to be staying as it is right now for the next little while, as far as we know.
What incentive do people have to go get a medical rec if anybody over the age of 21 can purchase?
That's a good question. Right now, that's the only option. So that's what people are doing when the regulations change and recreational or adult use cannabis becomes available. There's still a question as to how it will be taxed and whether maybe medical won't be taxed. That could provide some incentive. Insurance coverage. So some patients are already starting to see insurance coverage for their medical cannabis. So if that's the case, it's most likely that people will continue to access it through a physician. And then also, I still anticipate that a lot of the companies offer products in different formats and things that may just remain part of the medical sort of framework, and depending on their physician and what they need and how they're accessing it, they may still choose to go that route.
Yeah, I can probably speak to that because Oregon has both adult use and medical. The Oregon Medical Marijuana Program began in '98, and adult use opened up the market in 2016. And what we saw immediately after adult use legalization was a decrease in the number of patients coming in to get authorizations. But then it started swinging the other direction. So in Oregon, there still is a high incentive to get your medical card. Anybody in Oregon can grow 4 plants. Without a medical card, you're limited to that. With a medical card, you can grow 12 or more, depending on where you live. With a medical card, you can possess more, you can purchase more, you can purchase products with higher amounts of cannabinoids in them. You don't have to pay an added tax for purchasing, so there's still a lot of incentive. And I can tell you, the 55 and over crowd wants their medical card to validate their use of cannabis in the first place. So in a state like Oregon—
Validate for themselves, validate for—
Mostly for themselves. They're very proud of their cards. Yeah, they are. The other thing is from a legal standpoint, a medical card does offer you what we call Sort of. We call it, sort of an affirmative defense, right? If you get pulled over and you have paraphernalia or cannabis in the car with you, if you don't have your medical card on you, well, you can't make a great case for being a part of that program. But if you have that card on you right there, it could prevent you from getting arrested, from getting your products, taken away from you. So there is a lot of protections in having that card, as well as, yes, personal validation. From a revenue standpoint, yeah, adult use pulls in a lot more revenue, but the revenue that gets pulled in from the medical sector is still pretty strong in Oregon.
And so in Washington, D.C., it's a little interesting. So we have both recreational and we have medical. Recreational, there's nowhere you can go buy or purchase. So there's really this like overlooming like situation where you can grow the plant, you can possess up to 4 ounces, but truly there's nowhere for you to purchase it if you come into our jurisdiction. So there is a medical program, though, that would allow you to purchase 4 ounces every 30 days. And our qualifying conditions, which changes from state to state. So that's a great point to make, that in DC, it's any condition, any ailment. So if you go in and you have stress, anxiety, headaches, you can get a card. You can get the recommendation to get a medical card. That's what we call it in DC. The recommendation is actually what the doctor gives you. Some people call it a certification, and what shouldn't be used is a prescription. So that is one of the clarifying issues. But you can actually have that. In DC, having that card gives you the right to have marijuana and to possess it on you. But what the regulations don't address is that if, in fact, if you go to different events or participate in what we call pop-ups, that the DC Trade Association has made a point that we do not go after patients that have possession of marijuana, but we look for distributors. So there's a distinction, because as a minority woman who knows the history on the war on drugs, it's important that we do not target minorities in disproportion to any other community, to make sure that the patient has possession of their medication so they can treat themselves.
Thank you.
So here in Connecticut, we only have a medical marijuana program. Our medical marijuana program is administered by the Department of Consumer Protection. They also oversee our alcohol, our tobacco program. And so, we have a pharmaceutical model. So the only way that you can run a dispensary is to be a pharmacist or a pharmacy tech, which limits entrepreneurs from entering the space, and makes it difficult for the people who have been most disenfranchised by the prohibition of this plant to get in the business. But as far as patients are concerned, it's also very expensive. So a certification runs about $200, and to enroll in the state is about $100. So if you have someone who is at end of life or, has been out of work because of a disability, it's very hard for them to afford the program. But we are working to, create access. And right now, our patients do not have grow rights here. So they can't grow their own medicine, which would mitigate some of the costs that they have to encounter. So our program needs a lot of work and a lot of help. But, that's what we're here to do.
And there's, just to add, there's states that have more strict medical programs than Connecticut, very limited qualifying conditions. Only certain physicians have to register with the state to be able to write a cannabis rec. In California, it's probably one of the loosest states. We had medical cannabis since 1995. Any physician could write it for essentially any condition, and you could go to the Venice Boardwalk by the beach, get a recommendation in 5 minutes for about $40, $50. So that's you kind of an idea of the patchwork. And the last thing that I want to say on this topic is, despite having a medical cannabis recommendation, and correct me if I'm wrong, but despite having a medical cannabis recommendation, your employer still has full authority to deny employment or terminate employment for testing positive for THC.
Yeah.
Correct me if I'm wrong.
State employers can choose to hire or fire you for whatever reason.
That's something that has to be changed in statute with employment laws. It's very difficult to change.
Right. But then I think there's also federal laws about drug-free workplace laws that also, even if states try to protect that, the federal laws might limit that. Okay. So now that we've covered that, maybe we can now give a really 1,000-foot overview of how the cannabis or the hemp CBD market, how we're seeing a potential segmentation of strict pharma, this kind of nutraceutical model all the way to these like well-controlled state medical cannabis programs. So kind of maybe weigh in on kind of giving us a broad overview of how things are starting to separate.
I think in Canada specifically, there's a lot of different biotech companies, even from the States or from other countries, that are coming with technologies that they think are going to be very interesting to use to administer cannabinoids or other compounds from cannabis. So they're coming with all these different ideas. And I think, so as of right now, the Canadian government allows us to sell dried flower, oils, max concentration of THC is like, I think 3%, and oil capsules. So we're limited in, under the regulations are called the ACMPR. Under the ACMPR, we're limited as to what sort of formats we can sell. But these biotech companies are coming down the line with other technologies like patches or, other delivery systems. And so I think the sort of traditional pharma model is going to be conducting the traditional path of research and development that, follows phase 0 to phase 4 studies and approaches the government with a new drug submission, things like this, to get those on the market. And then there's going to be the products that are available under the current regulations still. CBD is going to be, even from, not only from hemp, but also from cannabis, is going to be regulated as a natural health product beginning later this year. So that means that you could buy it on the shelf at Shoppers Drug Mart or at Whole Foods or wherever it would be. So that's something that's interesting. It will have to have a maximum concentration of THC in it, which is very low to nothing. But so that's going to be that sort of like that health and wellness space. And then from the recreational or adult use standpoint, there's probably going to be several limitations on how much THC or what types of products can be sold. But that hasn't really been sort of defined as of yet, as far as I know.
Yeah, in Oregon, we have a strong hemp culture in addition to a cannabis culture, and people are hemp cultivators. They make their CBD dominant, products from hemp, and you can put those in the shelves in the grocery store. Recently, because the Oregon Liquor Control Commission, which oversees the adult use program, realized that they're missing out on a piece of that pie, are allowing hemp cultivators to register and license their own processing facilities to get their hemp products into the pipeline to get into dispensaries. So now we're going to see hemp-derived CBD products in dispensaries where that was actually prohibited for a little while in Oregon. CBD is everywhere. Okay, it's highly unregulated. European countries have their hemp-derived CBD products, or claim that's what they are. It's in the open market. You can buy a hemp-derived CBD product online right now and have it shipped to your door. The issue with that is that it's not regulated. Sure, it might be considered a medical food or a food substance or a supplement at this point, but recently a group of physicians pulled 80 products from the internet marketplace and tested those, and 30% of those had overrepresentation of the CBD that was actually found in that product, meaning there wasn't as much CBD as they claimed there was. Another third underrepresented what they had, meaning there was way more CBD in their product, and about 12% of them actually had THC over 0.3%, which at that point is no longer considered hemp. So that is happening globally. And then Big Pharma. So are you guys familiar with GW Pharmaceuticals? All right. Are you familiar? They've been going around petitioning to legislators in weak cannabis states to get a monopoly over medical cannabis. Yes, Big Pharma is coming. They're coming. And so we are going to, hopefully, what we're going to see is a competitive marketplace where they can live because they're coming. And so can all of our small business owners right now who are producing really phenomenal products. Some of them. I don't produce. But yeah, I guess does that answer the question? Okay.
So I'm going to piggyback on what Rachel said, because it's not emphasized enough. As being a formulator in a Fortune 500 company, the bioavailability of CBD in the product that could actually be available to help you or assist in that anti-inflammatory action it's supposed to have is actually not present.
Dr. Chanda, tell them about bioavailability. What is that?
So making the actual molecule itself to be able to be available so that when you use it, it's actually having an effect. because what the ingredients within that formulation sometimes encapsulates it. And so what we have is that a trend of mom and pops that have been creating these formulations. And they're great products. They could be soaps, they can be lotions, but they haven't been properly tested to know that they actually work. But it's because of the marketing aspect of that we see that the branding of CBD is like a great thing. Everyone wants something with CBD in it, even if it works or not. And as Rachel just said, what's important is that you don't know if it's even present because there's no universal testing and regulation on the product. So this is one of the concerns I have as a scientist, and the claims that are being made, which are unregulated in all markets, but can actually help or may not help the patient. So, you know, when we look at the state to state, when they come out with their regulations on what can be produced or not, they just say something like infused products. But who are to say those infused products are truly infused at what percentage, and if they actually have the effect? So these are some of the challenges that we have, especially on the East Coast, which is, I would say, a little tightly regulated by more entities like the Department of Health versus what we see the trend on the West Coast, which is based out of the collective grow, where you can grow your own plant, formulate your own products, and go up to the drive-in van and have it tested. So there is an integrity issue here that I see in that market and the hybrid markets, which are in between. I will give Denver credit by saying that there's some people that subscribe to more of a West Coast mentality versus the East Coast. But everyone's catching this, beginning to understand, but really the true emergers from this economy are going to be the ones that can deliver the true benefit to the patient. So it's just a matter of time before that comes out. And right now, everyone's throwing everything in the pocket, in the bucket. They're like, let's see who's going to rise. But as we all know, that marketing and branding can take us so far. But you buy Tide because it works. Am I right?
Yeah.
Okay, so we're gonna find out what products work. And those are the ones that are gonna be able to capture the market. So just be mindful, because I don't know what my audience is here, but if you're truly looking to get in the industry, whether from a health perspective or a business perspective, you have to make sure you deliver a product that truly works.
And on that note, so it sounds like there's a few issues, right? It's number one, did the product claims hold up? Is it useful for XYZ? Number two, is it labeled when it says it gives you 100 milligrams of CBD? Is that actually in there? And if that 100 milligrams is in there, then the third issue is that bioavailability there? Is that 100 milligrams, is it formulated in such a way that's going to actually end up in your bloodstream? And depending on what you combine with the cannabinoids, you will have very different rates of absorption.
Exactly, and that's where you see the mom and pops now, the trends. The mom and pops that do think that they have great products because of, I'm not going to say clinical feedback, but direct patient feedback, are now going with the pharmaceutical companies, the little ones that are starting to emerge, like the GW Pharmaceuticals, and saying, all right, can we work together to formulate this product to be even better? So again, that is where the trends are going to, and all manufactured goods.
Mm-hmm. And it's important because, you know, we have, again, a patient population with limited income. So, you know, if your grandmother was able to buy, you know, get $80 together and buy a good thing of CBD salve, and she uses it and it's ineffective, then that's $80 that she no longer has. So the products need to be tested and shown to be viable.
And Dr. Chanda is right. The people who are going to remain viable in the industry are people who are doing it right. There are several companies on the West Coast, between Washington and Oregon specifically, who have developed wonderful products that are effective for patients. And those are the patients that doctors at OHSU are telling, listen, this company here has a great CBD product for your child's seizure. Now they say, I hear about that because those patients come and tell me, no doctor's screaming from, you know, their rooftops that you should go buy this product. We to a degree, we can't do that, but there are great products that are emerging, at least where I operate. And I am able to tell patients, this is what you need to look for. The company or the brand has to have these sorts of practices. That's what I look for when I'm looking for products that I can talk to patients about. And so it's all about teaching the patient, patient consumer is what I call all consumers, how to go into that dispensary to find products that are, one, responsibly grown, responsibly processed, tested, and that are going to be effective for them.
And so on that topic of being able to refer patients and towards certain products, how do you guys back up your claims? So when someone walks into your dispensary, how do you steer them towards certain products based on their ailment? Or if you're a physician, how do you recommend what type of product for someone with patient? What's your evidence base there? How are you backing that up?
I would start in the supply chain with Dr. Knox, because in terms of the different ailments, sometimes it can get kind of complicated. And I say that, like if we're talking about pain, we know it's usually trauma or neurologically based, or we call it phantom pain that you might see. But if it's a more extenuated circumstance, the first person I refer to is the physician. So usually I'm texting Rachel where more extreme cases saying, okay, what do you suggest to treat this patient with? Because there is a break in our supply chain, we don't have access because of HIPAA regulations right now to communicate with what that looks like. And she doesn't necessarily know what products I have available and vice versa. So, we have to work in our different silos to get what we need. But Dr. Knox will say to her patient, this is what I suggest. And I love her advice about the load of CBD that each patient that gives. I'm going to pivot that back to you, and then I'll take it back from what actually I dispense. Because I think that's very important about using CBD just for homeostasis.
Oh, yeah. Just want me to say that briefly?
Yes,
what
please.
I say? Oh, yeah. So all the physicians in my group, we firmly believe that everybody should be getting in some CBD at approximately 10 milligrams for its anti-inflammatory properties.
And so once that is established, I come back and take the patient. Now, what I do is that I look at the cannabinoid profiles of the strain and the terpene compositions. There's some assumptions that I have to make as a biomedical research on how to treat the patient. And those assumptions are, one, I know when I say this, I'm going to get the chuckles because I always do. But have you heard of lemon skunk?
That's
I'm trying to be serious about medicine, but when you name it lemon skunk, it makes it kind of non-serious, right? So when you have lemon skunk, what is so pronounced about that is that you smell it. And when you smell it, you're smelling the terpene composition of that. And so that is that's the limonene. And so limonene is also present in natural products. So we're going back to that nutraceutical piece right here. And so if you were to take a slice of lemon and add it to your hot water, one is the natural diuretic, but two is the anti-anxiety medication. So naturopathic, yes, antidepressant as well. So now you look back at that in its form of cannabis. Then you have your patients try it for those same reasons. The thing is this is where Shannon's information is so important. Does it have its true effect? I can tell you, my patients that come back after they use it, especially using a temperature specific vaporizer, gets the effect. And then they do deeper purchasing based upon that effect. Not based upon it made me feel good, which we know that's the overall, but it actually addressed my symptoms.
So on that topic then, Shannon, tell us about, when you guys as producers, how you work with your patients based on their ailments to find the right products?
Sure. So the products are available a physician can authorize a patient to access medical cannabis in Canada, but it's not considered an approved medication. It doesn't have a drug identification number. It's not, hasn't gone through the same rigorous clinical trial as pharmaceutical products have. So we can't make claims on our medication and say, this variety will help your anxiety, or this variety will help your sleep, or this one, you should use it if you have depression. So we can't say things like that. So, but we do need to help guide our patients and our physicians, sort of in the direction of which varieties will probably be best suited for them. And the way that we've, the program that we've developed, so we have a few different avenues for doing that. So sometimes we will, in many cases where we can, we conduct actual clinical studies where we do observational studies in the community or clinical trials and sort of collect data in a very controlled manner on different products, so we can sort of try and validate, claims. But the other, simpler way that we've been doing this since we first started bringing on our first patients in 2014 is we launched a survey program where we survey patients at their intake and then at 2 follow-up points after their treatment starts. And we basically collect information from them regarding what symptoms they're experiencing, what products they're using, how their symptoms are changing over time. And what we're finding is there's some significant trends, depending on the symptom or condition a patient has, in terms of which varieties that they're finding to be most efficacious for them. So we use that data to feed back to the community and say, they're patient-reported outcomes, but we say, if you're experiencing PTSD, other patients in the community who also experience PTSD prefer these varieties, so you may want to start trying there. So that's sort of a program that we have launched, and it's been successful so far in helping, start that groundwork for that research that we need.
Yeah, and I think that speaks really well to the fact that we all have to work together to provide meaningful services to the patient consumer. Cannabis is absolutely probably one of the most interesting botanicals that exists. And if somebody says, purple kush works for this, for me, that purple kush may not work for the next patient with the exact same condition. And that's because depending on environmental reasons, really anything that has to do with cultivating that plant, if it's not standardized, if it's not the exact same thing every single time that you harvest, you're going to come up with a different chemical profile. So in addition to what you just explained, we talk to our patients in terms of chemo profiles. So we talk about cannabis strains as chemovars. And so it's very important that when we start talking about the cannabinoids and the terpenes in terms of milligrams, right? Because that's how we translate effect. If I take 2.5 milligrams of CBD, it treats my anxiety. And if I do that 4 times a day, I'm good. Versus I have this disease and I require 25 milligrams, right? We start talking in milligrams. Percentages makes no sense. Yeah, this product has 25% CBD. What does that even mean? Clinically, that means nothing. So having those conversations that you're having with producers and cultivators and producers and people in the dispensaries, then we're actually creating an ecosystem where everything that we do starts to make sense. And patients can rely on a system that can provide them consistency. And I think that's one of the biggest issues that we have right now, especially when we're facing big pharma who's coming in with their standardized dosing. And it can tell you the medical professional is going to prefer standardization to just throwing darts at the wall and hoping they hit. Now, I can tell you what we do is way more precise than that, but that makes a strong case for them.
So on the topic of standardization and pharma coming in with their products, let's talk a little bit about what, if we're looking towards the future, what does the standardized product look like? Is it going to be individual cannabinoids that we're focused on? Is it going to be a combination of a whole plant extract that we've somehow standardized? Where do you guys see this going? And maybe touch on what are your thoughts on this so-called entourage effect?
We're never going to improve upon nature, and nature is an entourage. And I think the science has proven to us, and even the clinical application of cannabis to pathophysiology, that the whole plant is better than a single cannabinoid. Take Marinol, for example. It's been on the market since the 80s. It's a synthetic THC. It is highly potent. It's way more. It is toxic. It causes way more unwanted side effects than just smoking a high % THC, flower would. And still I have patients who say, I've taken Marinol, I hate it, I prefer the whole plant. So I hope we have a barrage of all. And I'm not sure what we're going to come to see with, isolates in the future, but I don't think we're ever going to beat the whole plant, especially since we know that the entourage effect depends on that terpenoid, chemo profile to even enhance the effects of THC and CBD in the first place.
I think that if pharmaceutical or if licensed commercial producers start moving towards a pharmaceutical model where they're sort of controlling or trying to standardize, it's very difficult to do in a dried plant or in a plant at all. But when you start looking at technologies for extracting compounds and reformulating things and putting them back into other products, it's possible to achieve, closer to standardization. And so I think it's going to be a matter of certain compounds in the plant are going to be considered active ingredients, and we're going to want to standardize how much CBD or how much THC or maybe certain terpenes that we have enough evidence to suggest these are, these do have a physiological effect. But then there might be other compounds that just sort of in a suite of other compounds that we pull out of the plant that we can put back into a product, and that sort of helps that entourage effect, but we may or may not be able to or even need to standardize the concentrations of those. I think or maybe some companies will find some sort of perfect magic formulation of all these compounds and keep that secret. I'm probably sure they will, or not.
I think that will work.
Yeah, but anyway, I think standardization can be achieved to some extent in certain product formats. Yeah. And it might be favorable for the medical community to some extent. For prescribing, because it's the way that they understand how to prescribe a dose, and even some patients who want to be able to just, know I just need to take my 5 milligrams or my whatever. Standardization can be good.
Yeah. Well, I think what a lot of people are missing though is epigenetics, the epigenetic of things, right? Our endocannabinoid systems are.
What are epigenetics?
Epigenetics. Okay, so we have genes, right? And for a long time, we've thought that we can predict disease based off a person's genetics. The reality is that our environment indicates how we look, how we think, how we manifest diseases way more than people ever realized, right? You can take identical twins and put them in different environments, and one of them is going to develop high blood pressure and the other one isn't, right? And high blood pressure is one of the things that we have always said, this is hereditary. But in reality, is it? It's a disease of inflammation, and one person may be more overexposed to inflammation than another, and maybe that's the reason why. So epigenetics is really the environment's influence on us with respect to how we manifest disease. So to speak to that, is everybody in here familiar with the endocannabinoid system? Just raise your hand so I know who. Okay, great. Yes, good. It's always in flux, all right? And it is the system in our body that is controlling homeostasis, balance. And so we could assume that a perfectly balanced endocannabinoid system would mean a perfectly healthy individual. But that's not the case, right? If we don't get enough sleep, and we're really tired in the morning, we might have, for the moment, a very blunted endocannabinoid system. Or we're on a plane with a bunch of people with a cold, and some of us, 2 days later develop a cold, some of us don't. Maybe that's because some people's endocannabinoid systems were more primed and in a healthier position than somebody else's. We don't really know, but what I can tell you is that even if we standardize doses of cannabinoids and terpenoids, that may treat your anxiety one day and may not the other. And it's really, really complex, but it's also very beautiful. We're all very different. And that's why different chemo profiles can work on two different people that have the same disease very differently.
Well, and I don't think that philosophy might not be unique to cannabis, right? It's this whole push towards.
Correct. Yeah.
So maybe, okay. This whole push towards personalized medicine, right? This is not, cannabis might be a really interesting, test case or pilot case for this, but the idea that the same medication, the same dosage is going to work differently for different people with the same disease.
I'm going to jump in here just to add on this conversation. So what we see in the dispensary itself is that there is a trend towards manufactured products. That is also a tribute to different things. And I will say it's ease of use, mostly the convenience of it, the discretion, the smells. But I will say that our patients use that when they have to medicate conveniently. But I will always say that our base operations, when I look at our numbers, over 50% are still focused on the flower because of the benefits that Rachel said. So I'm gonna have to say there is still a hybrid. I'm not gonna say completely trending towards just all manufactured products for standardization. I think that is convenient, especially for the soccer mom that's bipolar that cannot roll or vaporize out and open, but can discreetly microdose with a little bit of tincture in a water bottle and sip on it while their child plays soccer. So there's a different, perception that it's depending on the lifestyle. So I think that as the message or the education gets out on how effective the plant is, you'll see that trend actually fluctuate based upon the person.
Very cool. Thank you. Let's switch a little bit of gears now. We've been talking a lot, this is in terms of the health side. What are some potential side effects that you warn people about, or what are some kind of public health issues that you guys might have been thinking about due to the widespread access to cannabis?
So the first thing I always warn everyone about is edibles. They're so convenient. I mean, it's so easy to use, but they're the strongest form of cannabis, infused cannabis products. That's because they're metabolized systemically over and over. And so when people who don't know how to dose properly with an edible, they actually go to the extreme. And that's where you hear that I had a bad episode. I over-medicated. It went bad really fast. You'll see.
Yeah.
And those are my scientific words.
That's what they say.
So I really focus on edible etiquette and safety because it truly is a powerful long-term effect. Usually when you take an edible, it's 6 to 8 hours. So if you're under pain for 6 to 8 hours and you have a chronic pain, not like a cramping pain, which is like this. That's an immediate effect with a vaporizer. It nullifies it, it's short acting, perfect for cramps. But if you are a chronic pain patient, your pain goes like this and it stays. And so then everything you try to do actually impedes your quality of health. So what we do is bring down that threshold. And that threshold with the edible can last 6 to 8 hours. And we see this usually, unfortunately, with my opioid replacement patients. And I'm going to put that back to Dr. Knox about the opioid epidemic. But I will say that that is one of the bigger issues that we see. So edible safety, especially as it pertains to pain, is really a concern, especially in the opioid replacement therapy.
Yeah, I say cannabis enthusiasts hate to hear that there are risks to cannabis. And yeah, there are. I mean, just the unwanted side effects of THC can be risky to some people. And I guess the scariest symptoms are racing heart or panic, worsening anxiety. So if you're somebody with an anxiety disorder, we have a conversation about the effects of THC and how that can exacerbate, an attack. Heart disease might be another thing, right? If we're worried about transient elevations in the rate of your heart pumping, well, if you have an arrhythmia, then we have to talk about the risks that too much THC may pose to you. We don't want to trigger an arrhythmia. Again, we have no deaths due to cannabis overdose, but we certainly don't want to start now. Something that some people aren't hip to is the fact that cirrhosis is actually hastened. So the scarring in a liver with somebody with cirrhosis gets worse with THC. That's a prime concern of mine in an adult use space. Bud tenders aren't medically trained. They don't know to ask a person, what kind of diseases do you have? Do you have cirrhosis? And if somebody's recreating with a high THC product, they actually could be worsening their disease. Now, we don't care about that in terms of alcohol legalization. Certainly people in bars and at the liquor store aren't asking people, do you have cirrhosis? Right? But I think we need to be doing that differently. Cannabis is unequivocally a medicine. Alcohol isn't, right? And so I think that we could improve that conversation surrounding adult use and properly educating the public. Another concern is drug-drug interactions. You know, principally we're concerned with anti-epileptic drugs and warfarin, a blood thinner, because they're metabolized through the same pathway in the liver. And so hypothetically, your anti-epileptic drug may be hanging around a little bit longer because you have cannabis on board. So there are a lot of things that we have to discuss in counseling people on how to use cannabis and what chemical profiles to use. You know, maybe we can get away with a little bit of THC if we have more CBD on board, et cetera. But we, in the clinical space, we have to talk about those really relevant risks.
Thank you. And we are just about out of time. We have time for maybe one question. You were the first hand up.
I actually have a question related to the drug interaction. If you do anything sublingually that maybe bypasses your definition, does it lessen or eliminate?
Well, what I can tell you clinically is that we don't actually see people complaining of drug interactions. We have to say that theoretically, but we don't see any adverse consequences at all.
Yeah.
Have any of you described any evidence at well-conducted studies about placebo effect with CBD?
Anybody? I mean, placebo works than anything.
Yeah.
If I had a white coat on right now and I told you guys all that this bottle of water will lower your blood pressure, about 30% of you might actually take it, and about 10% of you might actually have a lowering effect.
And the placebo effect is heightened especially for cannabis because it has a miraculous reputation. So if I gave you a sugar pill and told you it's a sugar pill, you'll get some placebo response. If I gave you a pill and said there's cannabinoids in there, it's not, you'll get even greater placebo response because you have this increased belief of it. That's
Everybody should read a book called
Skeptical
The
Chihuahua.
Biology of Belief.
Skeptical Chihuahua.
But, you know, with
The Biology of Belief. It's an extraordinary book that speaks to the placebo effect.
But with federal prohibition, research is very limited, despite the hypocrisy of the fact that the United States has a patent, number 6630507, which says that cannabis is not only an antioxidant, but it's also a neuroprotector. And so, you know, those are the areas that we need more development in, and to be able to understand the way this plant works. And the United States knows that it's a good thing.
Yeah, and just to speak to placebo effect, what's wrong with that? I'm not saying that anybody's suggesting there's anything wrong with that, but as a patient, you know, I would be a study of an N of 1, and what works for me works for me. Do I need a randomized controlled trial or gold standard? Does it need to be double-blinded? Does it need to be, you know, do I need that sort of level of evidence to convince myself that something that already works for me is working for me?
Cool. We are actually out of time. Yeah, they're giving me the cane. But if you have any questions, come talk to us. Come talk to our panel. Thank you all very much for coming out. Give a round of applause to our panelists here.